Welcome, everyone. Welcome to our VRT for Wisconsin. Just doing a slide adjustment here. Okay. Welcome. Thank you, everyone, for being here with us today as we're talking about veteran oral health in Wisconsin. I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health. I use she, her pronouns. I have Rahel here from AIDPH as well, who is assisting us and helping us out on this call. If anyone has any questions or troubleshooting as we go through, you can check in with Rahel in the chat. And I'm going to say, go ahead and introduce yourself with your name and organization in the chat. We strive for these to be interactive sessions. And we would love for you to make some connections with your colleagues in your state in the chat as we go through. And just noting here, Rahel, if anything pops up in the chat or something gets wonky on my end, please just give me a shout because I don't have full visibility here. Okay, so we're going to go ahead and get started here today. I'm giving us an introduction. We're going to talk a little bit about who we are as AIDPH, talk about veteran oral health and the national level, and then we're really going to dive into what veteran oral health looks like in Wisconsin. I mentioned that we strive for these to be interactive sessions. We want to share the data and resources we have about your state with you, but more importantly, we want to hear from you. Is there resources that you need? Are there projects that you're working on that you want to share with your colleagues? We would love to hear about those in the chat. We're going to use Slido to interact. I will talk about that a little bit more here in a second, but just letting you all know if you're able, please come on camera and get ready to share and interact throughout this presentation. Some housekeeping pieces. We are recording this session. It will be available via our academy afterwards. The slides, the materials that we share here today will be available with that recording. I already invited you to type your name and organization in the chat, so if you haven't done so, please go ahead and do that. And if you have any questions along the way, you can post those for our staff in the chat as well. Okay. So we are going to use Slido today to engage and get some information from you and hear what you think veteran oral health looks like in your state. You can go to slido.com and enter in this number here, or you can use your phone and scan the QR code and it will pull up our session directly for you. So I will leave that up in a second. And Rahel, are you able to pop the slido.com and the number in the chat as well? So as we go along, if people need to re-reference that, they can get that. Okay, so pull that up and we're going to get started with Slido in a second here. These are our learning objectives for today. These were included in your registration information and are tied to our CEUs, encompassing what we'll be learning here today. Okay. So now we're going to warm up with Slido. So if you toggle over to that website, either on your phone or your computer, again, I think Rahel popped it in the chat if you hadn't yet pulled it up. We want to get started by hearing about what brought you to today's session. So did you come here to learn, to share, connect, or act, or perhaps it was all four? And I'm going to see if I can pop us over and see what folks are sharing. Okay, great. 100% learn. I love that. All of the above, also great. Really wonderful. Okay. Well, great. I hope we share things that you learned today. And I hope that we, again, learn from you and connect as well. So that's fantastic. And now we have a test with Slido under our belts. I'm going to go back to our slides. Sharing that I am the presenter for today and I do not have any disclosures or conflicts of interest to share. AIDPH is hosting this in partnership with Oral Health Wisconsin, and we want to give a shout out and a big thank you to Cassia and Oral Health Wisconsin for helping us coordinate this, share the information out with you all, and make sure we could have a great community discussion here today. Okay. We're going to go back to Slido again. And as we're getting started, we want to know, what do you believe the top priority areas for veteran oral health are in your state? This will help us tailor our content here today. I'm going to go back and take a look. So we have access to care, oral health literacy, workforce development, policy advocacy, integration with general health care. Okay, so far we're at 100% access to care. Integration with general health care is the second, which we're certainly going to talk about. Um, and I think you all may know that we are working to deliver a state-specific veteran oral health seminar in every state in our country. We have several under our belts at this point. We're almost to half of the states in our country, and access to care is always number one when we have this conversation. Integration is super important as well. And again, we're going to dive into that a bit more. Okay, great. Thank you for sharing. And don't close Slido out because we're going to come back to it again. Okay, so let's get started. Starting with who we are as AIDPH, we are a 501c3 nonprofit. Our mission is to empower our community to advance oral health through science, education, and advocacy, which is we're doing all three of those things here today. We're looking at the data that our research and impact team has found and put into usable tools through an educational seminar. And we'll talk about some advocacy that we can do around this data that we have. We do this work because we have a vision of a justice-oriented oral health system. We have 4 communities of focus at AIDPH, which includes LGBTQIA+ people, veterans, people with disabilities, and people living in rural communities. Of course, we understand that there's intersectionality on these 4 communities of focus. Today, we're talking about veteran oral health, and we'll really see that intersectionality. Looking, approximately 30% of veterans report having a disability. Approximately 25% of veterans live in a rural area, something we're going to talk more about today as we dive into the data. And all of our communities of focus have the common experience of historical exclusion and marginalization from healthcare systems. We want to say thank you to our funder for this programming, which is CareQuest Institute of Oral Health. We have a long-standing partnership with CareQuest, specifically in veteran oral health. We launched our first survey in veteran oral health in summer of 2021. And since then, have really built a body of work on veteran oral health data. We've had the privilege to take that data and do several different advocacy initiatives with that, including a Hill Day in 2023, another Hill Day this past spring, and we're here today. So sharing all of this to kind of really speak to the work that we've done in veteran oral health, and that this is work and data that has been worked on for many years at this point. Okay, so we're going to start with an overview of veteran oral health and take a look nationally. So this might be familiar to some of you, but doing this work again for many years now, we've found that many people don't understand the eligibility process, sometimes even veterans themselves. What care veterans can receive, or even where and how they can access the care. And that's why we like to really begin by setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at the national level before we dive into the state level. So the main point I want to make here is that eligibility for medical and dental care through the VA isn't set by the VA itself. It's determined by Congress through a federal law called Title 38. And that law outlines what care is covered, who qualifies, and where it can be delivered. And because of that, any major change, like expanding dental coverage, requires congressional action. It's not just a policy update, it involves passing new legislation and then securing federal funding to support that legislation. So when we talk about the limitations in access to dental care for veterans through the VA, it all ties back to laws at the federal level. However, I also want to point out that that doesn't mean we can't take action and impact change at the local and state levels. It takes getting educated about what veteran oral health looks like we're doing here today, and collaboration with local communities. And we'll highlight some success stories that we have seen at the state level. Okay. So the other big point here, the other takeaway is that currently most veterans are not eligible for dental care through the VA. So this graphic here we look at represents all 18 million veterans living in the US today. The lighter color half shows the veterans who either receive care outside the VA or aren't eligible for VA health care at all. And as you move to the left of this chart, the darker blue section represents the nearly 9 million veterans enrolled in VA healthcare. But of those, only a tiny fraction, that small blue and red segment, is actually eligible for dental care through the VA. Additionally, even among the 1.8 million veterans who are eligible for dental benefits, only about a third are actually using those benefits. So we need some more research into that utilization piece. We aren't exactly sure why that utilization rate is so low, but we suspect that barriers to care and lack of awareness play a big role in that utilization piece. So, really, we're left with a deeply inequitable system. Veterans either aren't eligible at all or face a fragmented oral health landscape that makes it really hard to get consistent, high quality care. And we know that this problem is even worse for veterans living with chronic conditions, where good oral health is especially critical. So, we're going to talk about that a little bit more here. Veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. Again, that piece might be familiar to some or all of us here. What's even more concerning is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poorer oral health outcomes for veterans than non veterans, even if they've seen a dentist in the past year. So, access alone isn't solving the problem. And even when veterans are getting dental care, many still face some of the worst oral health outcomes. So, we know it's a little more complicated. A reason for this is the lack of integrated care. These chronic conditions aren't being addressed in coordination with oral health needs. And that's why the issue is really frustrating. The VA is the largest integrated healthcare system in the country. The VA is uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, they're missing out on that critical coordinated care piece, leaving major gaps in their overall health outcomes. So we'll dial into this a little bit more. This is recent research from AIDPH conducted again in partnership with CareQuest that really focuses on the connection between chronic disease and oral health. So even for after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning they've lost all of their natural teeth, compared to veterans without diabetes. And that's a really powerful indicator of just how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. So again, looking at this a little more, just as concerning are the findings related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. And that reinforces what we're seeing across the board. Chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. So, looking at this at a system level, we really want to highlight here it's not just about poor oral health outcomes or reduced quality of life, although obviously those are very serious concerns. It's about the broader health impact and the cost of care. So, when dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental coverage was expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. So, again, that recent research that we did shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's even more striking. For every $1 spent on preventative oral health care can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's really paying for itself. And that's an important context to keep in mind as we look at chronic disease trends in Wisconsin and consider what solutions might look like there. So these are some data points collected through research from AIDPH and CareQuest. They come from BRFIS, which is a national survey of veterans administered in 2021, and from data accessed through the VA. So this is looking at rurality, qualifying for dental care through the VA, and what rural veterans are facing. Okay. This is looking at our dashboard on vetdentaldata.org, which we can pop in the chat if that's okay, Rahel, if you don't mind popping that in there. Really kind of showing the tools that are available. We have our state profiles available on vetdentaldata.org, but we also have several interactive dashboards. So there are interactive insights on rural veterans, cost of care, and state-based indicators, which can be accessed on the site. We have an entire tab dedicated to rural veterans, and while the data aren't available from MEPS, which is Medical Expenditure Panel Survey on a state level, they can be evaluated by region. So you can get a sort of proxy for state level data dialing into that rurality piece in your state. So you can go through and use these interactive tools and look up what's most applicable to the work that you are doing. Looking again a little bit more about what you can find on Vet Dental Data. When you click on the Rural tab, it will take you to this interactive dashboard on rural veterans. Across each indicator, it's clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. And this is all veterans, not just veterans versus rural veterans on the dashboard here. Okay. So again, just kind of dialing in a little bit more on what you can find on Vet Dental Data. Rural veterans also feel more impacted from lack of access and utilization of dental care, often citing that the state of their mouth or teeth is embarrassing compared to non-rural veterans. And rural veterans also struggle more with functional dentition, which likely leads to the data points we see around increased cost of care and higher emergency department use. Again, just looking at what we can find and what available resources are, we have all of our publications on vetdentaldata.org, as well as our state profiles and resources. So to kick things off for Wisconsin and give you some background on why we're doing this road tour, I've been talking about vetdentaldata.org. That includes research articles, state profiles, report cards, and those interactive dashboards we just looked at. If you hover over your state on the interactive map, you'll find a detailed profile that outlines what veteran oral health looks like in your state. And I encourage you to pull up Wisconsin, and we're going to dive into your state profile now. If you haven't already taken a look, you can kind of go along as we talk about it. So these profiles were created for all 50 states to provide specific, relevant information that's easy to access and use. We wanted to make sure that you can explore the data in a way that's meaningful to you and focuses on the issues that matter to your community. Our goal at AIDPH is never to be doing research for research's sake. We want to take it and make sure that we are translating it into usable resources. Okay, so hopefully the good part here, we're going to dive into Wisconsin and we're going to pause and start. You've been hearing a lot from me, so we'll hear from you for a second. If you toggle back to Slido, please share in one word naming what you think your state's biggest challenges for veteran oral health. So if you don't have it pulled up, you can scroll back up in the chat and pull up Slido with that code and share one word on what you think your state's biggest challenge is for veteran oral health, and we'll go over. Seeing access come up again, we saw that on the poll. Miseducation. I would love to hear in the chat on that education piece if you think that that is a lack of education or if there is actively misinformation floating out there as well. Lack of courage, VA working with other systems. I would love to hear more about that too. If that's in community care. I see folks still typing. We'll give it another second and see what folks are saying. Cost. Yeah, so if folks are barriers to care, if folks are so inclined, I'd love to hear more what the barriers are in your state. I think we're going to talk a little bit about that, a little more, that education piece, the VA working with other systems, and Rahel will interrupt me as needed to call in people's feedback on that. Okay. And if you haven't put your piece in, you can still do that even as we go back to slides. Okay. So what does oral health look like in Wisconsin? Again, we put these state profiles together to answer a simple but frequent question that we were getting doing work in veteran oral health. We were looking at it at a national level and continued to hear, what does veteran oral health look like in my state? So again, please pull up your profile and go along, and we will really dive in. And just want to note that we've done our best with the data available. And while it's limited, sometimes certain data isn't always available in every state. We obviously have thoughts on where we could expand data. These profiles really aim to offer clear, visual, easy to use information that can support conversations and decisions across different audiences. So really taking the data and putting it into layman's terms and into usable tools that you can use with decision makers in your work. So we start at the top of your state profile. So just like in this presentation, we open each profile with some quick context. What's happening in Wisconsin, how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. And the key point that we always include, again, just like this presentation, is that most veterans are not eligible for dental care through the VA. I always feel like a broken record when I bring that up, but I have given this seminar many times. I have done many advocacy pieces for veteran oral health. I myself, I don't think I mentioned, I'm the spouse of an active duty military service member. And I am still surprised. I almost every time I have this conversation, people are surprised that most veterans are not eligible for dental care through the VA. So again, policymakers, funders, decision makers, those are really the folks that don't realize this piece. So starting the conversation there and understanding kind of level setting is incredibly important. And that's what we do at the top of these profiles. So when you're starting a conversation, again, it can be a really powerful place to begin. And because of the gap at the federal level, it's states and local healthcare systems that end up carrying the weight, whether it's disease burden, access issues, or care delivery challenges. So again, when you're working at the state level, it's an important part to understand and start at. We've also included data on where veterans live across Wisconsin. You'll see that kind of in the highlighted green square over here, looking at that counties that have the highest veteran populations. Um, Veterans, again, are more likely to live in rural areas. And as we know, rural communities already face higher barriers to care and worse overall health outcomes. So looking at that location piece can really inform programming decisions, where to start decisions in your state. You can look at maps of where VA clinics are located, the resources they have, and that can really give you some insight into kind of maybe the disparities that veterans in your state are facing. So right up front, we hope this gives you useful county level insight to support better informed local decisions about how to deliver care and improve access. So then we look at some state-specific insights. And here we're comparing Wisconsin to national averages because without that national context, numbers don't really mean anything, right? So if you're sharing with a policymaker, a veteran, or a program leader, they might not know is 4% high or low, or somewhere in between. That's why we included those national averages to help you quickly see where Wisconsin stands. You can also compare across states if that's helpful. So when we talked about those interactive dashboards before, you can do a few different things. You can pull up, if you have a state that you know has a really similar system or environment to you, or that you typically compare from a public health perspective, you can pull up their state profile and compare side to side. You can also hover over that interactive map on vetdentaldata.org, and it gives you a really quick pop-up of information to kind of look across states and see how you compare. Some states have similar challenges or demographics. Again, you're going to know which states are most relevant to yours. And so again, all 50 states have profiles. They're all available and hopefully easy to compare. So earlier I mentioned chronic disease, those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. And because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you're talking with decision makers or planning programs. And that's why that information is included here, looking at Wisconsin versus national. And again, we have working age veterans and all veterans. Kind of looking at those different groups might depend on the programming that you're doing. So here you'll find data on heart disease, diabetes, insurance status, and indentualism, all compared nationally. And then we also ranked each state across the 4 key outcomes. So you'll see where Wisconsin falls compared to 50 states. So looking at that here in the state rankings across. Noting here that number 1 means the worst outcome. So that can kind of give you that context here. So we're kind of looking at some mid rankings here. And if you're interested in how we did these rankings or want to dive into the technical details, the full methodology is posted on vetdentaldata.org. And then we get to the grade portion of the profiles. Again, we chose this design so that it could be easily usable. Everyone knows what a report card is. I think probably almost everyone has gotten a report card in their lives, and we felt like this made it a really easy tool to take and have those conversations with decision makers. We see grades individually given for diabetes, rates of uninsured and dental visits, the percentage of veterans in Wisconsin that visited a dentist in the past year, and those combined for an overall grade. And what I want to point out with this portion is to encourage you to not only look at the areas where there is a lower grade and an obvious call for an improvement, but to look at those areas of higher grades, right? I'm looking at an A in diabetes. It can really show you a success story. So taking a look at where your state is succeeding and exploring the why or how you got there. Maybe you were involved. Maybe your organization or your programming was involved to improve that one area. It can really illustrate a path forward for some of those areas that need improvement. Additionally, you can use that same tactic when looking at other states. So looking at your neighbors or states who may have a similar environment, whether that be veteran populations, government structure, healthcare infrastructure, etc. It can be a helpful tool in finding those successful models. Again, in a minute here, we're going to highlight some state success stories that we have found. But if you have colleagues in other states and they have an A in an area that you don't, collaborating and seeing how they got there can be extremely helpful in finding a path forward for programming for your state. Okay, so I'm hopping out of the profiles and back to the dashboard here a little bit to highlight some other pieces. And just want to state that the dashboard allows you to quickly gain insights on key indicators, comparing other states to the oral health status of veterans in your state. Again, this tool you can hover over and pull things up really quickly, and it can be helpful for decision makers who want to gain insights into their state and surrounding states when it comes to improving veteran oral health. Just gives you that opportunity for a quick overview and a quick comparison. Okay. Again, you've been hearing from me a lot, so we want to make sure we're hearing from you. And I would love if you could take a minute and post in the chat what one barrier that isn't reflected here in the data, but you know is real for veterans in your community. So we know that we collect data across certain indicators, and it's not always fully representative of what we have going on in our communities. And I know some folks brought up barriers in our word cloud earlier. Was there anything already in the chat, Rahel, that you wanted to call out? I'll give you a chance to reflect and post that in there. And we say one barrier here. It can be more if you know of more. And I'm going to go ahead and get started on our next pieces. And Rahel, you can dive in and interrupt me as needed if folks are posting in the chat.
Oh, actually, we just received a few. Sorry, Liz.
Okay, no, that's okay. Yes, please go.
So Nicole said financial support programs. Um, and Kazia actually posed kind of a thought and question. She said, I'm curious how many veterans in Wisconsin have access to reliable transportation, since that can be a barrier to care in general.
Yeah. Yeah, I think, and if folks in Wisconsin have responses or thoughts on that, I would love to hear that in the chat. Um, Transportation is something that comes up over and over again. I mentioned at the top of the call that we have veterans and rural communities as two of our communities of focus. As you can imagine, it comes up for both of those communities, and again, the intersection of those communities. Um, and the thing that I have found having this conversation in many states across the country is that transportation issue is always comes up. It is in every state, but the barriers to the transportation are different in every state. So it can be urban and there isn't a great public transportation infrastructure, or it can be rural, and that really depends on the geography of the state. So I'm thinking of a conversation in Montana where um, it was really seasonal, and in the 9 months of winter that they have, needing snow tires and having big barriers there and people not being able to afford changing out their tires on the car. But during the spring and summer they had transportation. So the piece there that always occurs to me is connecting with other organizations in your state, organizations that are providing the transportation, or maybe working to solve that, thinking of those kind of non-traditional partnerships that we can make in public health, and dialing down and talking to veterans in your state, to people in rural communities in your state, um, and what the transportation barrier is, and then finding reverse engineering solutions from there. Was there anything else from the chat, Rahel, that popped up?
Yes, Carrie also posted a comment. She said the limitations the VA system has for tooth criteria related to dental care, even for veterans that do have access to VA dental benefits.
Yeah, exactly. Um, and I hope, hopefully these tools can think through some programming around those, and also maybe inspire some advocacy on changing things at the system level as well. Okay. If anything else pops up for help, please feel free to chime in. Thank you, everyone, for sharing. We appreciate that. Okay. So we've gone through the profile, and I've talked a bit that we really wanted these to be usable for you. So how do we use them? I hope the details were informative, but really what we want you to take away from this session is next steps and how you can leverage these tools in your work. So using the data to illustrate the need, sharing the profile to start conversations, and taking action to elevate success stories. So let's look at that a little bit more. We have advocacy, educating stakeholders, decision making, and reports and grants. So what do we mean by that? One of the most powerful things we can do with this data is advocate, and that can look different depending on your role. Maybe you're a provider, a policymaker, a veteran yourself. This profile gives you credible local data to bring to city council, state legislators, your congressional reps, etc. Also, advocacy doesn't always have to be legislative advocacy. You could organize a listening session in your community, invite decision makers, hear from veterans themselves. Remember that small advocacy actions like calling an elected official, submitting a public comment can ripple outward in big ways. And even starting conversations with colleagues, sharing this out, that in and of itself is advocacy for the issue at hand. So, as such, educating to empower. So, many people working in healthcare or veteran services don't know how stark the oral health gap is. We've talked about the access piece. We've talked about the intersection in the of with chronic disease and how even if access is available, the outcomes are still poor. And so that's where education comes in. You can use this profile to lead a short talk at your organization's staff meeting, again, educating colleagues, organizations that you're involved with, briefing a coalition or partner organization. When stakeholders are informed, they become allies, and that's how we build momentum. So, this is really an opportunity to collaborate across silos. Maybe you bring this to someone in housing or mental health. We talked about that transportation piece, right? Food access, to find a new way to align the programs and efforts that you already have in play. So, informing strategic decisions. So, this data is really a tool for strategic thinking, whether you're leading a nonprofit, managing a health program, or advising policy. You can use the profile to help decide where to focus. Again, looking back at kind of that location piece and the mapping piece, maybe there's a rural county with no dental providers or population group that's at a higher risk, and that's where you need to start. This also helps you make the case for why you are investing resources where you are. And if you're doing evaluation or reporting, it gives you a baseline. So here's where we're started, and here's what we're trying to shift to. Okay. So, in that vein, let's talk about how we can use the profile to bring in resources for the work that you're doing and the programming that you're doing. So, grant makers and funders want to see data and they want to see it grounding in the community. And this profile hopefully gives you that or a start to that. You can use it in your problem statement of your grant request to show gaps in care. You can also use it to cite as a foundation for what your solution will address. So, again, that evaluation piece, using this as a benchmark if you're measuring outcomes and deliverables of the program that you have grant funded. Hopefully, this will give you that baseline that you can show the progress that you have made. Okay. So again, I want to pause for a second and hear from you. Which of the four uses for the state profile, advocacy, educating stakeholders, decision making, or grants, feels most relevant to your role and or your organization? I invite you to come off mute and share. If you would feel more comfortable posting in the chat, I invite you to post there. If you would like to share a little bit about the work that if your organization is doing work in veteran rural health, we're happy to hear that too.
Well, I don't want to just leave you hanging there, Liz, so I'll step up. Um, Obviously, from a state standpoint, we can't be involved in advocacy. We have to be very careful on that fine line type scenario. So educating stakeholders is a big area where DHS, et cetera, can be involved in that realm, that role.
That's great. Yes, we're always happy to just wait uncomfortably so folks chime in, Dr. Dunkel. Does anyone else have thoughts they want to share?
Liz, I think a key piece is educating, providers, not just the individual provider, but practice, the whole practice,
Mm-hmm.
because this can really look different based on, the practice you're coming from, what type of practice you're supporting, right? So the one piece that we work on, and I'm from a community health center, is ensuring that the veteran service officers are aware that we have financial assistance programs. Now, recognizing that that only reaches so far, right? We're in northern Wisconsin, we can reach so far, but I think that beyond that, how do we get our name out in the organizations that help to support veterans daily, so they ensure that where there are access points, that they are educated from a one-on-one perspective when they're looking for resources, right?
I love that. Thank you. And really exciting the work that you're doing. Does anyone else have pieces that they want to share? Okay. I will also say, Nicole, that your piece with kind of educating everyone and different types of practices, that's a conversation that comes up on these across other states as well. And to the point of sometimes when we have this much information and we see this much of a disparity, we can feel overwhelmed and are unsure where to start. And sometimes the conversation is even changing intake forms or that front office manager. You might not be working at an FQHC, you might be working at a private practice and serving veterans, but you don't know. So even starting with that understanding of if you are serving veterans, it can be as I say simple as that, with the acknowledgement that any type of change can be complicated and is not always straightforward. But that conversation comes up over and over again in every state of kind of across the board education. So I love that piece. Thank you. Okay, we're going to hear from you a little bit more in another poll. Um, again, you can toggle back over to Slido, and we want to be leveraging these tools in our research to best serve the work that you are doing. So again, we want to hear from you about what additional tools would be most helpful to your work. Our goal is always to support our dental public health community. And so really looking, is it additional education materials for the consumer, policy briefs, research findings, training module? What would help you most in the work that you're doing? Okay, I'm seeing education materials. I think I see that training modules. And I think I see that reflected in what we've answered previously about kind of the information piece and the education piece. Okay. All right. Thank you. You guys can keep, if you haven't responded, you can continue doing so. We will capture this information. Again, we're not just asking to ask and have it be part of the seminar. We really want to hear from you, and it informs the work that we do next and what we focus on internally. Okay, so we talked about, I promised that we would give some state highlights of success stories. And so I'm sharing some policy advocacy spotlights here and some places where you can look if you're considering initiatives in your state. So Florida passed legislation creating the Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. And this program is designed to provide dental care to veterans living in Florida. The department will partner with a statewide direct support organization to administer the program. That organization will distribute grants to nonprofits with a strong track record of serving veterans, and those nonprofits will deliver care to eligible veterans based on income, service history, and other qualifying criteria. So this was very new legislation that just started being implemented, I think, spring of this year, maybe April comes to mind. So it's very new, and we're keeping an eye on Florida to see how it's working. It's a really innovative approach, and to see it come together is exciting and something that we're keeping our eye on, and suggest if that sounds like, every state has a different environment, a different political environment. And so looking at states that have done innovative pieces and thinking through if it matches with what's going on in your state. So that's certainly something to keep an eye on. We also like to talk about Oregon. Oregon developed an innovative Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. So veterans are first screened to determine if they qualify for either. And if not, they're enrolled in a local coordinated care organization and receive free dental care through a network of community clinics participating in the program. And then in Iowa, we have had the privilege of doing a real deep dive of veteran oral health in Iowa. I will talk about that a little bit more. But Iowa uses state lottery dollars to fund the Veterans Trust Fund. And that fund provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care, and has really been successful. And is an interesting, again, kind of approach and local solution to some access to care issues. So talking about that a little bit more, veteran oral health in Iowa, just sharing out here some work that we have done on veteran oral health in Iowa. We had the privilege of doing a full research in their state. So beyond just the state profile, we did a year of research in Iowa on veteran oral health. We developed out, I think it's 75-page report with strategic recommendations. And from there, we were able to take those recommendations out into the community, host a series of virtual forums, culminating in an in-person summit on veteran oral health in Iowa, and really hearing from those stakeholders, going through some facilitation and decision-making processes with them to really identify the strategic recommendations that were most viable for the state. And then, which we have just pushed out, a summary. I'm sorry, I misspoke. We published a summary of that Veteran Oral Health Summit. And then we have upcoming a strategic plan, which we pulled from that summit, an advisory group, and it put it into actionable steps for the state of veteran oral health so that organizations in Iowa have a very clear path forward to data-informed solutions to veteran oral health in their state. Data-informed and community-informed from the stakeholders there. We're really proud of that work and excited about it. This is just highlighting the strategic recommendations that we have there. We have a page if you're interested in that work. We're happy to chat more about what that could look like in your state or the lessons learned from Iowa and what stakeholders have going on there. Okay. So, again, I hope you're feeling activated. I hope you're feeling informed, but I also know that this is a lot of information to take in. We're all very busy. And so I want to leave you with one concrete, easy step to take after this session to maintain the momentum that I'm hoping you feel leaving this session. And that's to share the state profile with one new person or organization. And if you're willing to post it in the chat, who you're going to share it with, I would love to see that and to hear that. We can kind of keep each other engaged, encouraged, and accountable to our call to action there. Okay. So our next steps, we have a few pieces. We have CEUs available for today's session. Rahel is going to post that in the chat. Those are hosted on the AIDPH Academy. If you have not been there before, you need to set up a username and login, and then you can get CEUs for this session. You can go to past sessions for this program or other programs and get asynchronous CEUs and have them all available in one place. Again, we will post the recording and the resources for today's session on there. The other piece that we're going to post in the chat here is I mentioned advocacy. We've had the privilege of working on veteran oral health advocacy, and a huge part of that is ensuring that we are leading from behind and that we are sharing and amplifying veteran voices. As such, as part of our advocacy initiatives, we are working to gather stories from veterans with a storytelling form. We want to hear more specific first-person stories on their oral health. And so if you are a veteran yourself, if you know veterans, we would love to hear from veterans in your state about their oral health experiences. We're going to post that form. It's hopefully very easy to use, very easy to share, to collect those stories. Again, all of the resources that we talked about were on vetdentaldata.org. And we are saying that veterans deserve equitable oral health. We have a few minutes before the top of the hour, so I'm going to stop sharing and come on screen and just make sure I have time for Q&A if anyone has anything they want to ask or share. Okay. We are always available via the Academy, via email. We are happy to answer questions. So please reach out. Keep an eye out for the resources that we will post after this. And thank you for being here and taking time to learn about this important topic with us today. I hope everyone has a great rest of the day.
Great. Thanks, Liz.